The quality of the conversations with the patient and their loved ones are crucial if ReSPECT is going to have any meaningful impact on patient care. Many health and care professionals are already highly skilled at having these difficult conversations. Some, however, are less confident. The following section provides some helpful tips on communication skills. However, you may wish to pursue further training within your organisations. Remember that communication is a two-way process. Information is given, information is received, and both parties must listen. And you must check that the party receiving the information understands what is being given.
The key stages of the ReSPECT conversation are: understand. Establish a shared understanding of the person's state of health and what they might reasonably expect in terms of progressive deterioration or abrupt health crisis. Set goals. Establish what is important to the person and what they see as the main focus for their care and treatment, balanced between sustaining life and maximising comfort. Plan. Discuss the treatments that should be considered as well as those which they may not want or may not help them.
There are likely to be many opportunities to initiate a ReSPECT conversation. Sometimes the patient may give you cues that a conversation would be helpful for them, which may be verbal or not. If a patient mentions emotional symptoms such as "I worry, it scares me," this could be a great opportunity to open the conversation. They might mention physical symptoms such as changes in sleep, which could be a way of trying to share emotions without directly talking about it. Look for subtle hints to hidden emotions such as sighing, silence and frowning. Remember, these patients won't necessarily know about ReSPECT or feel like they have permission to discuss such things with you, so they might not give you any cues at all. Open questions are a really good place to start, such as, what do you understand to be happening? What are your thoughts about the future? Is there anything you would like to ask me?
Did you know that the words that we use only make up 7% of what we try to communicate? The rest comes from body language and tone. Body language, such as an open posture, eye contact, touch, with active listening and non-verbal encouragement such as nodding and facial expressions, communicates to the recipient, "You are important, you have my attention, and I am listening." Poor or false listening often will leave the person feeling undervalued, angry, upset or unheard. Use silences to help conversation. It can feel awkward to force silences in conversation, but it provides an opportunity to reflect, and the patient may be more likely to fill the space. Are you self-aware? Check your tone and your body language. We are all human and have things going on other than work. Sometimes your mind might be elsewhere. Internal emotions can transfer through your tone and body language without you realising. Having self-awareness will support you to address this.
Remember that we all have different values, beliefs, ways of living and preferences for planning or not planning for our future. You may have tried various ways to engage a patient in a conversation and are just not getting anywhere, and they just do not want to talk about these things with you. It's okay to give the patient an information leaflet and reassure them that they can take some information away, have a talk about it with a loved one and return at a later date, or see another healthcare professional if they would prefer to have these conversations with them.
Make some time for your patient and set expectations at the start. If you have just 10 minutes to give, make sure you let the person know and that you can revisit the conversations at a later date. What knowledge and awareness does the patient have? Seek permission to open discussions. Explore patients' priorities and goals for their care and treatment. Who else should this information be shared with? Support for you and your patient. Do you need to involve another team member? Would your patient benefit from involving a loved one in these discussions? Show you are listening. Try and see things from the patient's perspective. Offer a review if it's appropriate.